All right, today we're diving deep into type 1 diabetes. We're going to break down exactly what's going on inside the body. So let's kick things off with a real puzzle, a paradox that's right at the core of this condition. How? How can your body's cells be literally starving for fuel while at the exact same time your blood is absolutely flooded with sugar? It just doesn't make sense, right? While the first clues to solving this mystery, they usually show up as this really confusing, kind of contradictory set of symptoms. Doctors have a name for it. They call it the classic triad. First, you've got polyuria, which just means you're going to the bathroom all the time. Then there's polydipsia, this crazy, excessive thirst you just can't quench. And on top of that, polyphagia, a huge increase in hunger. But here's the real kicker, the part that makes you go, huh, all of this is happening while the person is actually losing weight. So yeah, it's a confusing picture. Let's really unpack these signals. What is the body trying to tell us with all these classic warning signs? And it's super important to be clear here. We're talking about a very specific type of diabetes. Type 1, it only makes up about 5 to 10% of all diabetes cases, and it usually shows up pretty early in life, in childhood or as a teenager. So what's the root cause of all this? Well, the answer is, it's like a civil war is breaking out inside the body. It's a tragic case of mistaken identity, where the body's own defense system, its immune system, starts attacking a vital part of itself. All right, let's get our bearings. The whole problem starts right here, in this small but incredibly important organ, the pancreas. You can see it's kind of tucked away behind the stomach. And while it does a lot of other things, like helping with digestion, for our story, this is ground zero. But here's what's so fascinating. The immune system isn't just carpet bombing the whole pancreas. No, this is a precision strike. If we could zoom way, way in, we'd find these little clusters of cells. They're called the pancreatic islets. And inside those are the real targets, these microscopic little factories called beta cells. And all of that brings us to the textbook definition. Type 1 diabetes is what we call a chronic autoimmune disease. Put simply, the body's own defense force gets confused and just wipes out those pancreatic beta cells. And the end result of all that destruction? An absolute total lack of a hormone that is critical for life, insulin. Okay, so insulin is gone. Why is that such a big deal? Why is this one hormone so unbelievably important? Well, let's think of insulin as the body's gatekeeper. It's the master key that unlocks the door to cell energy. So in a healthy body, this whole system is it's beautiful, it's elegant. When you eat a meal, those beta cells in your pancreas get to work. They produce insulin and send it out into the bloodstream. And from there, it travels all over your body, like a tiny messenger with a very important job. And this is its main job, and it's such a great analogy. Insulin is the key. The cell has a lock. That's the insulin receptor. When the insulin key fits into the lock on the cell, click, it opens a special gate for glucose. And that allows all that sugar from your food to finally get out of the blood and into the cell, where it can be used for fuel. Key, lock, open gate. Simple as that. So, what happens when the gatekeeper is just gone? When there are no more keys? Well, the whole system breaks down. And the consequences, they just cascade through the body, one after another, like a set of falling dominoes. This comparison really lays it all out, doesn't it? On one side, you have a healthy body. The insulin key works, the gate opens, glucose gets in, and your cells are fed and happy. But on the other side, with type 1 diabetes, there's no key. The gate stays locked shut. And now you have this tragic situation where the cells are literally starving for energy, while all that potential fuel just piles up, stuck in the bloodstream. And there's a medical term for that pile-up, hyperglycemia. It just means high blood sugar. And that brings us right back to that paradox we started with, right? A river of fuel flowing through the body that the cells can't touch. So, what does a body do when it's starving? It panics. It hits the emergency button and kicks in a desperate backup plan. Since it can't use sugar, it starts burning fat and fast for energy. The problem is, this emergency fuel source isn't clean. Burning fat this way creates these acidic byproducts called ketones. And when those ketones start building up, they make the blood dangerously acidic. This dangerous chain reaction can quickly spiral into a full-blown medical emergency. It's called diabetic ketoacidosis, or DKA for short. And this isn't a minor thing. It is absolutely life-threatening. And what's so tragic is that for many people, especially for kids, this terrifying experience is the very first sign they have type 1 diabetes. But it's not hopeless. There is a way to manage this. The solution is all about manually taking the reins, stepping in to do the job the body can no longer do for itself. It's about using insulin therapy to bring things back into balance. And really, it all comes back to that simple key analogy. If the body's factory can't make the keys anymore, well, you have to get them from somewhere else. You have to provide them from the outside. And that's why insulin therapy isn't just a good idea, it's not just a treatment option, it's absolutely essential for survival. Okay, so how does that work in practice? Well, one of the most common strategies is called basal bolus. Just think of it as a two-part system. First, you've got basal insulin. This is a long-acting type that you take maybe once or twice a day. Its job is to provide a slow, steady background drip of insulin, just like a healthy pancreas would. Then you have bolus insulin. This is the fast-acting stuff. You take this right around mealtime to cover the rush of sugar you're about to get from your food. But it's so much more than just taking shots. Managing type 1 successfully is a whole lifestyle. It involves things like insulin pumps for a more continuous delivery, really carefully counting the carbohydrates in every single meal, keeping an eye on exercise, and constantly checking blood sugar levels. It's a never-ending, data-driven effort to keep that balance. When you boil it all down, living with type 1 is a constant, 24/7 balancing act. It really is. It's about having to manually and consciously do this incredibly critical job that for most of us, our bodies just do automatically without us ever having to think about it. And that really brings us to the big question, doesn't it? Right now, management is all about replacing the key that's been lost, but there's no cure yet. So you have to wonder, what does the future hold? Are we going to see breakthroughs that make managing this easier? Or, and this is the big hope, could we one day figure out how to prevent this autoimmune attack from ever even starting in the first place?